In our Staying Healthy report today, a new report finds flaws in the multi-billion-dollar diet drug industry. The review finds dozens of weight loss and dietary supplements are labeled illegally. It also says most products do not have enough evidence to back up their health claims. About 1/5 of the supplements even had illegal claims to cure or treat a disease. New research suggests that beta blocker pills don't prevent heart attacks, strokes, or cardiac deaths in patients. That said, doctors apparently are reluctant to stop prescribing these drugs based on this particular study from the Journal of the Medical Association. At a minimum, it's thought that new studies will begin on the effectiveness of beta blockers. So we'll watch for those and we'll let you know what they find. Now, a new Salmonella warning to tell you about, this time for salmon. More than 100 people in the U.S. as well as hundreds in the Netherlands have been made ill by it. The salmon has been traced to the Dutch company Foppen, which sells through Costco. The wholesale club has pulled the items from shelves and has blocked products from scanning at registers. Customers who purchased the product will be contacted, but we do want you to know about this. And we've asked our regular medical contributor, Dr. Dianne McCallister, to talk about the recent outbreak of foodborne illness. We've seen it, Dr. Dianne, in peanut butter. We've seen it in cantaloupe, just to name a few. And now smoked salmon. This is very disturbing. So refresh us on the subject of Salmonella. What does it do?
Salmonella is a bacteria that will give you frequent loose stools that are bloody, and you sometimes get fever and you just don't feel well.
So it's just something that'll make you feel miserable.
Yes, unless very young people and immunocompromised people can get it as a bloodstream infection, and then it's extremely serious.
Very dangerous stuff. All right, what is the treatment for Salmonella?
There are antibiotics that will treat both the diarrheal illness as well as the bacterial bloodstream illness.
Now, we've heard about these outbreaks more often, it seems. Are they becoming more often? Are they coming up more often, or are we becoming better at detecting it and knowing when it's out there and spreading the word to the public?
So foodborne illness is a very common thing over the ages, and I think we're becoming more aware of it. Statistics from the CDC show that actually between 2010 and 2011, there was a 3% increase in Salmonella, but if you look back to 1999, there actually has been a 10% decrease in Salmonella cases over that period of time.
All right. So what are other common foodborne illnesses? Because I can think of others that we've reported on. So let's list them for our viewers.
So norovirus is a common one. And then in addition to Salmonella, there's Shigella that also produces a similar illness. Listeria, E. coli, toxoplasmosis, there's a list, Campylobacter, so there's quite a few.
And are these things that we can handle ourselves? Say you have a product that has been, compromised in some way. Can you cook it out of the food? You wouldn't do that with smoked salmon probably, but can you cook it out of other products?
So that's why we cook poultry really well. That's why you don't want to eat raw eggs, is because they're associated with being contaminated with Salmonella, and cooking will kill it. However, in these cases where it's an outbreak from the packaging of the food, you just want to get rid of the product.
So dispose of it or take it back to the store.
Exactly.
All right.
You don't want to take chances.
What are some other things that we can do to protect our families?
Well, the CDC has made foodborne illness a winnable battle for 2020, and that's because it is preventable. So the most important thing you can do is wash your hands before you prepare food every single time. Secondly, prepare meats and vegetables separately and clean everything after meat, before you touch anything else. And then, be careful about where you eat. Make sure you don't leave things out sitting in warm areas, because the bacteria grow in the warm environment. And keep foods properly refrigerated immediately after purchasing them.
All right, these are all common sense things to do, but it's nice to hear them from you again as a reminder. We appreciate that. All right, Dr. Dianne McCallister, as you know, joins us every Wednesday, and you can find her advice on thedenverchannel.com. If there's a topic that you want to see her discuss with us here, email us at 11 a.m. at thedenverchannel.com.